Hello everybody, this is Dr. premature and I am today going to talk about one of the most challenging subject in the gynecology and infertility area, which is the premature ovarian failure. Premature ovarian failure is a cessation or a stop of the menstruation before 40 years old, and it's a disastrous situation for most of the women because all of the women think that they will be mother or they will have menstruation cycles until at least 50 years old. And despite of that, in early age of the woman reproductive age, the whole of the chance of being mother or having the regular cycles will be stopped. Premature ovarian failure most of the time has genetic origin, and some of the infections like virus infections like mumps and coronavirus can exacerbate the ovarian aging and produce cessation of the menstruations in early age. Most of the time, the cause of the stop the menstruation before 40 years isn't clear, and we cannot name them for the patients and the anxious patients, angry patients, and hopeless patients cannot be convinced why the problem has been happened. Most of the premature ovarian failure wishing to be mother because they are in young age, in their 20s or their 30s. Up to now, the best and the easiest and the speediest, the most speed way to get the pregnancy is the oocyte donation. And besides that, there are several experimental attempts for doing some treatment for the POF patients, but unfortunately until now all of them are experimental, and there is not any certain treatment for POF patients. Injections, plasma-rich plaquette (PRP), or stem cells to the ovaries had some promising and heartwarming results, but in very, very, very slow cases. And as you know, the century is the genetic interventions in the medical treatments. There are also several attempts in animal study for changing the genetic situations, but unfortunately in the human they are in the very, very beginning step. And another important thing in POF patients is the problem that will be happen because of the no estrogen in their bodies. And you know that estrogen is the most important hormone during reproductive age in women. And if the source of the estrogen diminished suddenly, the risk of the cardiovascular events unfortunately will increase. Besides that, the problems in the hearing, in the eye, in the bone structure also can be happen after cessation of the estrogen secretion from the ovaries. In POF patients, we recommend doing a hormone replacement therapy until the age 50. But because of the fear of the some cancers like breast cancers, some patients refuse to do standard hormone replacement therapy. In a woman without family history of cancer, breast or other secretory cancers, the chance of getting breast cancer because of the hormone replacement therapy, which means using exogenous estrogen and progestin, is less than 3. But if the chance of getting the breast cancer increase in a patient, or the patient refuse to do the standard hormone replacement therapy, we recommend them to use estrogen only without progestin, or use another kind of the progestin like dydrogesterone. Recently, I've recommended in my patients to use the hormone replacement therapy each month. 1 month they use and 1 month they don't use. Beside that, they should have exercise, regular exercise, mostly weight-bearing exercises, and using also calcium and vitamin D besides the hormone replacement therapy. But I should emphasize again, the only way and the best way and the easiest way to get the pregnancy right now is using the oocyte, another oocyte, and oocyte donation. And I hope in near future we can suggest another options to our patients, thanks to the high speed progression in all of the area of the medical treatments and diagnosis.